Okay, so hello everyone, my name's Lewis. I'm a first year STP student specialising in respiratory and sleep science. Today I'm just going to give a little overview of the STP, sort of breaking down the course a little bit, and then also just detailing some things that will be useful for your application and sort of best way to try and really make it stand out, get you onto the next stages of each of the application process. I'm currently working at the Rostock Hospital, and I completed my undergraduate degree in sport and exercise science at Liverpool John Moores. So if we just start off firstly looking at the STP, I think this has been covered in a lot more detail in previous presentations, but mainly the actual job role. You're going to be working as a trainee clinical scientist as a band 6, and following your completion of training you'll be eligible for HCPC accreditation, making you a clinical scientist. Looking at the academic aspects of the course, I'm currently sort of based with Newcastle University, so I attend block teaching weeks throughout my 3 years. These vary in length, so my first week was 6 weeks, and then going back in March is going to be 3, and again these can just vary in length. Most of the academic component is covered by in-person examinations, essays and presentations, and again the content from the university really underpins a lot of your learning for the course. And then looking more at the work-based training, you'll be completing rotations within your specialty and sort of things that are similar. So as I say, currently working as a respiratory and sleep scientist, so we complete one rotation there. I'll also work in cardiac, neurophysiology, and then I'm currently based in critical care at the minute. Again, these rotations happen in your first year, as you specialise more in your second and third years. You're based more in your clinic, so I'll be mainly working in respiratory and sleep. Similar to some assessments as the academic component, when you're based at your hospital, be completing things such as case-based discussions, observe clinical events, and direct observed practicals. And again, these are good ways of just demonstrating your ability to work as a clinical scientist, and again how your attributes are developing along with the course. Just a quick overview of my field, specifically working in respiratory and sleep science. So it's really underpins by the completion of routine and highly complex diagnostic procedures to assess several aspects of lung function and sleep disordered breathing. This is mainly covered in both inpatient and outpatient settings, so I'll be working in specialised respiratory clinics. This can be offering medical management, sort of surgical opinions, fitness for surgery, and then also lots of our clinics are used to sort of monitor and look at the effectiveness of treatments that are given. It's quite a broad and interesting job within respiratory and sleep science, even though not much is known about it. So we offer various things. So one of the main things is going to be lung function testing, which we can see in this middle picture here. It's one of our body boxes. So here we can be doing things such as spirometry and gas transfer and lung volumes. Again, a routine test for us, but really important for helping to diagnose lung conditions such as COPD and asthma. You can then move on to things more advanced, so capillary blood gas analysis, which you can see on the left in our blood gas room. And again here, lots of different patient cohorts, looking at the O2 CO2 values, and again this helps us to provide services for various specialties, individuals with interstitial lung disease, motor neuron disease, COPD. A little bit more specialised again at allergy testing, so again this can be mainly used for patients with asthma, so we can do things such as skin prick testing. And then one of the main attributes you'll develop on the STP, exercise testing, which you can see on the picture on the right. So here we can fundamentally be doing VO2 max testing, again preoperatively, looking at patients if they're going to be fit enough for surgery, and then also and individuals that have attended for lung function testing. The results may be clear, but there's still an underlying cause for that shortness of breath, so it's something we're investigating further. We're very interested in respiratory muscle function as well, so again we have specialised MMD clinics. This can be really useful and a good skill to develop, looking at the actual mechanics of breathing and how this can sort of affect many of your tests. We offer specialist oxygen assessments as well, so again individuals with COPD, interstitial lung disease, things like that, may be offered long-term oxygen therapy or ambulatory oxygen therapy, so we can bring them in, sort of get a baseline reading, complete things such as 6-minute walk tests on varying flow rates of oxygen, and sort of titrate that accordingly to their needs. And then lastly, the more sleep and ventilation side, so this can be treatments for obstructive sleep apnea, non-invasive ventilation, so again for individuals with neuromuscular diseases. And again, this, as you move on the STP, this can get quite advanced, so you can be bringing patients overnight and observe them for a full night's sleep, for example. Lots of electrodes on the head, ECGs and things, and really have an in-depth look at sort of why the main complaints of their sleep is happening. Just putting everything together for my journey into the STP and specifically into respiratory physiology. Again, just started off very basic, BTEC at college. I did undergo some hospital treatments and went through some of the breathing tests and the exercise testing at the hospital I'm working at now, and it's given me real enthusiasm for physiology and exercise. So I started my undergraduate degree at John Moores. I graduated with that in 2023. Really fortunate. I was able to get a role the year I graduated at the hospital near me, Royal Stoke, and here I started the new postgraduate diploma course based at Sheffield Hallam University. So I was employed by the trust, and very similar to the STP, I would complete various block teaching weeks. Again, this gave me really good underpinning knowledge of respiratory physiology, and the year-long course really helped me to develop as a practitioner. Then completed one of our accreditation body exams this year, the ARTP, and then following on from this, applied for the STP in January. Quite a long process, and now just starting my first year at Royal Stoke University Hospital. Even though managing working at the same trust, I did have to apply as an outside candidate. So again, this is something to bear in mind for people. Even though you might think you're at a disadvantage against people working in hospitals, because of how the funding works and things, everyone will sort of be going through the same process, so it is competitive for everybody. Looking more at application advice now, it's going to be the main thing most people are interested in, sort of based into 3 steps. So obviously first your initial application. First bit of advice for this is to really understand the personal specification and the questions that are being asked on the National School website. The questions do change slightly each year, but again the personal specification is going to be relatively the same. And again, it's going to sound really boring, but so my bosses do the marking for the course for the STP. They'll be often at night going through 100 applications, and they literally will go through the personal specification and see which bit in your application are ticked off. So I'd aim to try and at least make sure you're ticking off all of those, demonstrate your ability or show your ability with how you've demonstrated that and why it's important. Again, really basic. When you're looking at your personal specification, just making sure everything you write in is applicable to that and you demonstrate your ability to do it. Secondly, would be gaining relevant experience. I used to find this quite hard, and people used to say this to me because I know gaining hospital experience is really hard. So again, if you can, any volunteering posts at hospital, reaching out to any contacts you may have, even if it's just a couple of days or a week just shadowing a department. But if you can't get that, I never had any hospital experience. Just trying to, anything you've got relevant that you've done, any busy environments, any clerical work, anything to do with confidentiality of documents, just trying to demonstrate that and show your ability how this could be applicable in an NHS working environment. Third aspect, utilising LJMU resources. So again, great steps attending career events such as this. Utilising the careers team at John Moores is really, really good. Helping them to go through the application process with you, asking for tips. I'm not sure, again, might be able to read your application, just help sort of see bits that may be altered or changed. And again, same with the tutors as well. I was really fortunate to have good connections with personal tutors, seeing if they can help with the application process, get you involved in any sort of research or study groups, and just really see if they can help to give you any guidance and advice. And then finally, the main application process. As we said, the markers are going to be going through hundreds of applications. Everyone's going to be having really good results, lots of experience, and everyone's going to be, say, a really good candidate. So really important you demonstrate your enthusiasm and show how you are going to be different to anybody else, fundamentally why they need to employ you. And I think the best way of doing this, not often talked about, is linking your attributes to the good scientific practice document. So this document sort of underpins the STP, underpins the clinical scientist, has 5 domains, has everything that you have to demonstrate and develop on the STP to be a good and safe clinical scientist. So when you are listing things, attributes or things that you've completed in the past, really good to put those 2 aspects down and then link it to one of the domains of the good scientific practice document. As I know personally, it helps you get better marks for your application. Also shown you sort of got good underpinning knowledge of what the STP and what a clinical scientist is. Then move on to the situational judgment tests. So again, these are range questions in clinical scenarios. You're going to be sort of ranking these to least appropriate and most appropriate. Again, these are very sort of basic questions, and even without any clinical knowledge, you can still achieve really well on this assessment. The main way you're going to be doing this is understanding the NHS values in the Constitution. So really basic things: patient safety, dignity, confidentiality. So when you're going through the questions, remaining calm, just understand the purpose of the question, linking it back to the main NHS values and the Constitution, and just looking at the best, most simple way you can. And again, this aspect can be done quite well, even with limited clinical experience. And then finally, the interview process. So this will be a couple of months down the line. Again, firstly, making sure really clearly you're demonstrating you know what the good scientific practice document is, you understand it, and again, linking it, demonstrating how the skills and attributes you've got work within that document, and how you're going to sort of impose that within the workplace you're going to be working. I think it's quite important as well when you do get a link for your interview. It's going to be from the individual or the hospital trust that are interviewing you, so make a little bit of effort just to understand them and the local hospital trust. Each trust is going to, and the individual is going to specialise in different things. So firstly, they might ask a question on it, and secondly as well, I think it just makes you seem a little bit more enthusiastic and really switched on, and it's just a good way to try and get the interview team on side. And then lastly, many of the questions within this interview process aren't going to be specialised. They're going to be very generic science questions, so it's really important you demonstrate your understanding of the NHS and the ways this can develop. So I know some questions can really be sort of very generic and sort of bland as things: how can AI help the NHS? Okay, or being asked to go to a school environment and deliver a presentation on healthy eating. Okay, they're going to be really nothing to do. Some of them are going to be nothing to do with specialty, going to be generic science questions. So again, just methodically, just thinking about ways in which this applies to the NHS, and the best ways in which things you're going to do, attributes you've got, are going to help develop the NHS service and also the service of the person employing you. The various resources you can use within the interview process. Number one, so I was based in the Tom Riley building for most of my undergraduate years, and the resources from your individuals such as your tutors, again asking them questions about ways in which you can develop. They might have links to previous students that have got onto the STP they might be able to put you in contact with. Completing things such as your major project as well. This is going to be really important, as within sort of part of the STP, they want you to be an independent practitioner that can develop research skills. So within this process, it's a really good way to collaborate with other students, PhD students, and also working with tutors, develop your skills. So within sports science, this could be learning sort of echoes, or sort of VO2 max testing. So it's really important you engage in this major project, engage with your tutors, especially after lessons. Constantly try and learn new knowledge, and really develop your skills at university whilst you've got lots of free time. Secondly, the careers team at John Moores provide lots of excellent support for students. Again, it's free to access. You have lots of time at university to use it. And again, these can set things up such as mock interviews, reading your actual application. And again, they've seen hundreds of students go into the STP to know exactly what you need to do to get onto it. Thirdly, utilising sort of past and present students as well. So this just like an Instagram page, so one of my courses running. I think you can just about see the title of the page, but again, I'd recommend following things like that. Other platforms such as LinkedIn, lots of STP students are very happy to answer any questions that you may have, as we've all been in that position before, sort of unsure about the best ways to approach the application process. So again, reaching out, following pages such as this, and contacting us. I will put my email at the end, and I'm more than happy to go through any applications or just any questions you do want to ask. And then finally, a little bit boring and going over the point again, but understanding the good scientific practice document. It's going to be a link at the end again, but this really is going to underpin everything you're going to do as the STP. So if you can show you the understanding, attributes you're already you can already sort of perform and demonstrate, and then your enthusiasm to develop these further on the STP going to be perfect for the application process. So that's the end of everything. Thank you very much for listening. As we say, my email address is just there. I'm more than happy to take any questions, and again, anyone wants to send any applications over. I've also put the link for the good scientific practice document, a link to the actual national school page. Is again everything you're going to need for your application going to be on the school page, all the requirements, all the person specification. It's really important you know that inside out. And then finally, for anyone who is interested in any respiratory and sleep physiology, the ARTP and the governing body. So again, for specific respiratory applications, having a look at the website there, and understanding everything they want to go through would be really helpful and a good idea. So I'd say thank you very much for listening. That's the end of everything.